More local communities are now requiring people to wear face masks inside all public spaces to prevent the spread of COVID-19.
Here to answer your questions is Dr. Erica Shenoy, Associate Chief of the Infection Control Unit at Mass General Hospital. Doctor, thank you so much for joining us this morning. We do want to ask you, do you think these mandates will still have a significant impact on case numbers?
So the most important impact in terms of masking is going to be in crowded indoor locations where we know the risk of transmission is the highest. But we know also that the most important intervention that people can take right now is if you're not vaccinated, to go ahead and get vaccinated, because that is one of the strongest, actually the strongest intervention we have right now to prevent the spread.
And the new rules also apply to people who are fully vaccinated. How are they at risk right now?
So vaccinated people are highly protected from infection and most importantly for severe disease and getting admitted to the hospital. But we still know that you can get infected even if you're vaccinated. So for vaccinated people, some of the most important kind of subgroups to think about masking are if you yourself are immunocompromised or at risk of severe disease if you were to be infected, or if there's someone like that in your household, then it's really important to mask up.
Important to keep in mind. Earlier this week, President Biden said officials are considering booster shots at 5 months, even if 8 months is the recommendation. Some people are reaching that time now. So how should they feel about their immunity?
So I think it's pretty confusing right now if you're listening to the news and you hear 8 months last week and then 5 months a couple days ago. What's really going to matter is when this committee meets next week. This is ACIP. It's the group that actually advises CDC on the vaccine schedule. So I'm waiting to hear what they say about what the evidence shows related to the timing of the booster. But I think if you're vaccinated, you can feel pretty confident that you're protected. And we know that immunity wanes, but still the data today still supports that you're highly protected.
Okay, I want to ask you about this alert this week from the FDA begging people not to take the drug called ivermectin to treat or prevent COVID-19. What can you tell us about this drug? We know it's used in animals often, and why is it so dangerous off-label for this?
Yeah, so they actually, the CDC took and the FDA the stand of taking an alert to alert clinicians and individuals to not take ivermectin. So ivermectin is a drug that's used to treat parasitic infections in both humans and in animals. And while it's been looked at for COVID, the data right now do not support it as either treatment or prevention. But you can see from the graph that the number of prescriptions has increased 24-fold, and actually calls to poison control centers have increased 5-fold. And some people have actually ended up hospitalized for overdosing on ivermectin.
Wow. Okay. Dr. Erica Shenoy, Associate Chief of the Infection Control Unit at Mass General Hospital. Thank you so much for joining us this morning.
Thank you.